Hi everyone. Do you think that there's a patellar tendon tear in these ultrasound images of the knee? The answer is no, there's not. These are just post-operative changes of the patellar tendon related to a surgical procedure called a bone-to-tendon-to-bone graft harvest. It's the standard operation to fix a torn ACL with a patellar tendon graft. It's very important to ask the patient if they've had any knee surgeries before you do their ultrasound exam. This kind of patellar tendon appearance could easily be mistaken for pathology if you don't know the patient's surgical history. If you know that the patient has had an ACL repair, then you'll expect to see a patellar tendon that looks abnormal like this. You can also do a contralateral comparison to the normal side to show the difference. In this example, the patient had a right patellar tendon graft reconstruction of the ACL 4 months prior to this ultrasound. I included images of a normal right patellar tendon to show the difference in the appearance. Just to help you understand a little bit about what the procedure entails, when using the patellar tendon as an ACL graft, the surgeon removes the torn ACL and puts the new graft into the knee while making sure to line it up just like the original ligament. To make the graft, the surgeon removes a strip from the middle of the patellar tendon, which you could see on the arrows I put in the last image. The new graft includes this strip of tendon along with attached plugs of bone from the distal patella and from the proximal tibia. This is why it's referred to as a bone-to-patellar tendon-to-bone graft. When the surgeon implants the new graft, the bony plugs on each end of the graft fit inside a tunnel of bone. The body responds by healing the two surfaces together. I really hope this video helped shorten the learning curve for you next time you encounter a post-surgical patellar tendon. Bye!